just going to run through a bit of a pigment consultation practice to get you started in pigment treatments. So obviously when the client comes in, they will have filled out all the paperwork. They hopefully should have had a skin check with a doctor within 3 months prior to us treating. And we tend to do a test patch 2 weeks prior to doing a full treatment to make sure that we choose settings that we're happy with, that aren't too aggressive but are going to achieve some clearance for that client. So you start by explaining why pigment occurs in our skin. So sun damage pigmentation, I'll speak about melasma, chloasma later, but sun damage pigmentation is formed when our bodies are trying to protect themselves from the sun. So our bodies don't have many tools to protect themselves from the sun. What they do have is melanin, so our bodies try to throw up a bit of an umbrella of melanin on the skin surface to stop a bit of UV radiation getting through. So we end up with these patches of melanin on our skin, and that's our body putting up its little shield. It also, in lots of cases, our body produces tiny little blood vessels under that melanin. You can't really see them, but there's increased vascularity in those areas too, because the body's trying to heal itself and it's bringing a little bit more of a blood supply to the area. So that's why pigment spots appear. As we're young, we get freckles. As we're older, the spots start to enlarge. There's more and more melanin in them, because once triggered, the melanocytes deeper in our skin layers start melanin synthesis. So they start producing melanin deeper within the skin, then they form their own pathway and splat it on the skin surface. That's when it becomes visible pigmentation, and that's why pigmented spots, sunspots, age spots, things like that, do tend to get quite large and quite significant, because that pathway of melanin being produced and deposited on the skin surface is firmly in place. So when we're treating superficial pigmentation, we thermally damage the pigment on the skin surface, but we can't, and we can clear that, we can't stop that pathway happening. So what we really need to do is really encourage our pigment clients to be using a C serum, such as the Medicate C Tetra. Vitamin C serums are a really, really strong antioxidant barrier against further UV damage and further melanocytic stimulation, and it also acts as a bit of a blanket on that pathway. It just suppresses the melanocyte activity and suppresses that tendency for that pathway to continually be in place of depositing more melanin in the skin. So a C serum and a really good sunscreen and just strict sun protection are vital in any of our pigment clients.
Another thing to mention with pigment clients is that they'll also see a better outcome if they're using a retinol serum, so a vitamin A serum. Often we recommend the Medicate range, which we stock in our clinics. The reason we recommend that is that clients will see a better outcome if they're using a retinol serum, because the retinol will increase the rate of skin cell regeneration, so the production of new non-pigmented healthy skin cells. So if we've damaged and cleared the existing skin cells on the surface that contain a high concentration of melanin, if their skin's already quickly producing healthier new skin cells, they'll see a great clearance and a really good outcome from the treatment in general. So effectively it's priming their skin to respond better to the treatment. So ideally, any client who's coming in for fairly significant pigment work, we would love them to be on a C and an A, and also the Moisturising Daily Defense, the 50 plus sunscreen that lasts all day. So ideally, we'd have someone on an incredibly supportive skincare regime at home, so that combined with our treatments, we'll see the optimal results for that person.
So you would discuss with the client that what we're doing with the laser is thermally damaging or effectively cooking the melanin on the skin surface. So those skin cells that are containing lots and lots of melanin, we're damaging them and getting the body to shed them just as the skin cells underneath renew themselves. So after a treatment, what we're looking for is that melanin will go very dark and feel rough, like someone's got thrown sand on your skin. Really, it's not scabby; it's just rough. And then over about a week or so after the treatment, that'll shed and ideally reveal normally pigmented skin underneath for that client. Every pigmented lesion is different. Some respond really, really well with one session. Some require 2 or 3, and then because that pathway is so entrenched of melanin being deposited in the skin, it might need maintenance maybe once a year or once every 2 years because that lesion has recurred over time. The risks of pigment treatments, they are that we could heat up the skin too much while we're thermally damaging that melanin. So the risks are blistering, just overheating the skin, so like a nasty sunburn. It could potentially scar if we were too aggressive. So we definitely lean towards caution when we're choosing our settings to treat pigment. Always inform the client that it's a hot, uncomfortable treatment, but we do cool the skin down throughout the treatment with cold packs and little damp makeup pads. So we keep them as comfortable as possible. The full treatment on the face takes about 20 to 30 minutes, and we just cool their skin down as we're going, and then ice packs on straight afterwards. Let them know that it looks worse before it looks better. They'll have about a week of the pigmented lesions being quite dark, quite significant, quite visible, and then over time they'll just start to break apart and shed away. Not all pigmentation is purely and simply related to sun damage though. Some pigmentation is hormonally triggered, genetic, and that can be trickier to treat, particularly melasma or chloasma, sort of hormonally triggered pigmentation. Often clients will say that it started to develop or worsen when they were pregnant and has been there since then, or post children coming along. They can get often that's on the forehead. You'll sort of see a broader pigmented area rather than just freckles, and that the risk in treating that kind of pigmentation is that by treating with the laser we could actually excite the melanocytes in that skin and cause them to hyperpigment even more. So the risk is that we could worsen the condition. So what you would do is establish that client with strict sun care, strict use of a vitamin C serum, and perform a really cautious little stenciled out test patch in the area and wait about 2 to 3 weeks. I have seen some really good results now with clearing this kind of pigment, but we just approach it a bit more cautiously and we stress that the laser could do exactly the opposite of what we're wanting it to do. Occasionally a skin type will come in, a client with a skin type 4 or darker, and be very, very cautious with treating these people's pigmentation with the laser, because it's very likely that the laser will trigger further pigment development. So really with those clients, unless you feel it's a single lesion that could easily be stenciled out and treated, those clients would probably be more suitable to use a good pigment clearance product such as the Medicate White Balance Click Oxy-R. That's now clinically proven to be getting really good results in pigment clearance with obviously long-term use, and the client just needs to be really patient and persistent with pigment clearance and be very, very protective. That's the case with any pigment clearance really. It takes patience on the part of the client, because that even though one pigment treatment can achieve fantastic results, they will need more in the future, and they'll need ongoing sun protection and ideally ongoing product use such as the C serum.
Another condition that you might see come up in clients who come in for pigment treatments is seborrheic keratoses. So they're a benign pigmentation presentation as well. They sort of look like little scabs sitting on the surface of the skin. They tend to be raised. They're often not a very different colour from normal pigmentation, sun damage, freckles and things, but they're raised. They're actually a tumour really. They're a benign, completely benign growth, and it's genetic. Some people are just very prone to them and have hundreds of them all over their body. A lot of people just have 1 or 2. These also need to be checked by a doctor before we can laser them, but often that's done when the clients had their full pigmentation check prior to us being able to do any treatments here. So we treat them with the GentleMax Pro as well on a smaller spot size at really high joules, because we need to get through quite a lot of tissue there. They are raised. They snap and sort of bang, and there's a bit of a plume of smoke when you treat them, so you stencil them out really carefully, and just warn the client that there's a bit of a sound when you're treating. And then they frost at the time of treatment. They go a little bit grey or whitish. then they darken and they just drop off. They treat really successfully. The risks are the same with any laser treatment of potential pigmentation change or scarring, but in general, seborrheic keratoses are really easy and successful to treat. With aftercare with pigment, always expect instruct the client that they will look worse before they look better, because it can be fairly extensive, the darkening and crusting of the pigment. It's not, it shouldn't form thick scabs or blisters or anything. It's just that mild sort of sandy texture that I talked about. But it's definitely very apparent to the client when they're experiencing it, so just make sure they know about that. Aftercare is literally just caring for that skin gently while it sheds. So no harsh acid-containing formulas on the skin. Even the strong alpha-hydroxy acids and products that are great for the skin should be avoided in the early days after a pigment treatment. No scrubbing, no sort of intense exfoliating. It literally is just gentle cleansing, moisturising, ideally with the moisturising daily defense, or at least using moisturising and then using a separate high fat to sunscreen. And but the immediate aftercare after the treatment, we just apply aloe vera gel and cold packs, and just make sure that by the time the client's leaving the clinic, they're not in discomfort. They'll just feel a bit warm.
Another point to mention when you're doing a pigmentation consult is that the benefits of our Gentle Max Pro pigmentation treatments go beyond just pigment clearance. There's actually a clinically significant stimulation of collagen synthesis in the skin, and also a tightening of elastin fibres. So the clients get an overall skin rejuvenation just bonus of a pigment clearance treatment, really. And it is noticeable. Their skin will feel a little bit more refined and just a little bit better texture and tone. And that's quite significant. A lot of clients really love that side effect of the treatment, so it's worth mentioning that as well. It sort of helps clients get excited about the eventual outcome. So I hope all of that helps, but obviously any questions, please just ask me or any of the other nurses at any time. Thank you. Good luck.